COVID infection levels have reached a record high in the UK, but a senior government scientist has said there's a glimmer of Christmas hope after data suggested the Omicron variant may cause milder illness. An estimated 1.7 million people in the UK had COVID last week. That's more than 1 in 35 people. Dr. Jenny Harries of the UK Health Security Agency did warn that it's too early to downgrade the threat. Here's Amelia Jen.
This week has been one of records, each day since Monday breaking the previous ceiling for COVID case numbers. But with the booster campaign gathering steam, the Christmas we lost last year is just in sight.
Fingers crossed, we're all boosted, aren't
yeah,
we? We've just had the booster, so I think we're okay.
Yeah, we're waiting. We're seeing family tomorrow.
We're doing tests regularly, so I think we're safe to see our family, aren't we?
Yeah.
You know what? We're all together. We're happy. It's all good.
It's a bit better than last year, and everyone's a bit more happier.
And if the pile of scrumpled wrapping paper is bigger this year, it is precisely because across the country in the run-up to Christmas, we've been giving each other an invisible and invaluable present.
Our brilliant NHS, which has done so much good.
In their Christmas messages, both the Prime Minister and Leader of the Opposition thanked the NHS for the vaccine rollout. 31 million people across the UK have now been boosted.
Vaccination centres all over the country are open today and tomorrow as part of NHS England's Jingle jab campaign. They're hoping to get 1 million doses delivered by the new year. How are you feeling?
I'm feeling like actually ready for Christmas now.
I ideally wanted it before Christmas. It was just trying to find somewhere that did it before Christmas, but got there.
The race against the Omicron variant is getting tighter and tighter. New figures showed last weekend 1.7 million people across the UK had COVID. But in news the UK Health Agency called a glimmer of hope, official figures suggest Omicron is milder than its predecessor Delta. It is, however, more contagious.
Obviously, it is a significant concern to us. There is a very large positive number of people in the community, and we know that that will translate into patients coming into hospital. We're not seeing that rise yet, but we know it will probably come in the next few weeks. So we are bracing ourselves.
So what are the kind of practical things that people can think about over the Christmas period?
For the vast majority of people, we know that Omicron will be a mild infection. However, we also know that there is a percentage who will develop serious illness, and therefore the biggest thing they can do is to take up the opportunity to have the vaccine booster, to limit the amount of people that they see over the Christmas period, and to make use of things like lateral flows to make sure that they're doing as much as they can to keep themselves safe.
And while younger people are driving infection rates right now, we haven't seen its effect yet on the older population, something that's likely to change over the next fortnight as families get together to celebrate.
Well, a little earlier, I spoke to Patricia Marquis from the Royal College of Nursing. I started by asking her how nurses are feeling going into the Christmas period.
So for many, they will be feeling really quite anxious, already tired, already exhausted from the last 18 months, and looking forward to wondering really just how difficult it is going to get over the Christmas, New Year and January period. So I think for many, it will be a very difficult time. Whilst they try to have some sort of break and some sort of period with their families, it is difficult.
And are you seeing more people leave the profession?
Yes, we can see that there's more, first of all, there's more sickness absence at the moment, and there are many more telling us that they are going to make a decision to probably leave either their current job or the profession as a whole as a result of what's happened over the last year and a half.
Let's talk a little bit about the fears around Omicron. I mean, we are hearing that for many people the symptoms will be milder. Obviously, there's concerns about transmissibility and what that might mean for hospitalisation. What are your concerns about that?
So there's a glimmer of hope that it may not result in such severe illness, but it is clearly very, very transmissible. And just the numbers alone will mean that there are more people will be hospitalised. The NHS and social care is under immense pressure already, and it won't take very much. Only a small increase in the number of people being hospitalised will really overwhelm our services.
And we've heard there are plans to set up temporary hospitals in car parks and so on, if needed. Are we going to be able to staff those?
I think the simple answer is it doesn't look likely. We can't staff what we're trying to do now. We can be very innovative, and I hear lots of talk about bringing back reservists, using the military, volunteers, etc. But they're not a replacement for expert nursing and other care staff. Staffing those facilities, it will be very difficult, if not truly impossible.
So how do we fix this?
So the government needs to look at all the evidence, and what we need to know as a profession is that the government ministers will listen to scientific evidence and act as swiftly as it needs to protect all of our health services, not just for the staff, but for the public, who need to know that when they need the service, it's there.
And do you mean by that more restrictions?
It may be a range of things, from restrictions to looking at what the NHS can deliver right now for everybody. So it's really looking at the evidence and looking at what the science is telling us as to where the pressures are, when the waves may hit, and what exactly capacity will be needed at what point where. But it does look likely that in the next few days, some tough decisions are going to have to be made about the services and how we protect the NHS so it doesn't collapse under an increasing wave of health problems for people.
And finally, do you trust Boris Johnson to make the right decisions, to make the decisions you're calling for?
It is difficult to put your trust in a government that so far has done some things really well. The vaccination programme is a real testament to the NHS and what this country can deliver, but there's been other things that have probably worked less well. The lack of preparedness for this in the first instance, where we didn't have enough PPE for all of our staff, was very, very disappointing. So I think we need to see action from the government, swift action, decisive action, to enable us to trust that they will do the right thing, both for the NHS and for the public of the country.
OK, that's a very clear message. Thank you very much, and happy Christmas. I hope you get some time off.
Thank you.